Bernie Sanders is proposing a superb piece of legislation that he unveiled this week. Listen to this. Senator Bernie Sanders plans to propose a new rule Monday that would require pharmaceutical companies to charge fair prices for drugs developed with taxpayer-backed research, he told HuffPost. The rule introduces an amendment to the 1938 Federal Food, Drug, and Cosmetic Act, would force federal agencies and federally funded nonprofits, such as research universities, to secure a reasonable pricing agreement from a manufacturer before granting it exclusive rights to make drugs, vaccines, or other healthcare products. The bill is Sanders' latest attempt to stop the Department of Defense from awarding drug maker Sanofi Pasteur an exclusive license to produce a Zika vaccine developed over the past year by the U.S. Army. The mosquito-borne virus is sexually transmitted and causes devastating birth defects. Okay, so let's digest the basic facts here for a second. The U.S. government creates a Zika vaccine. They're going to give exclusive rights to that vaccine to a pharmaceutical company. There's a question as to why they should even do that. I mean, that seems nonsensical. But what Bernie's saying is, okay, look, if we're going to do that, here's what has to happen. The U.S. government needs to secure a reasonable price. So in other words, we're only going to give you the rights to sell this if you sell it for a reasonable price, and now let's have a negotiation to determine what that price is. So that's what Bernie Sanders is stating. Now, every other modern nation does this. Every other one. If the UK or Canada or Australia or any other government does research, develops some sort of a cure, some sort of a treatment for something, if they're going to turn it over to pharmaceutical companies, they say, all right, but we're only going to give it to you. What are you going to sell it for? We need to agree on a reasonable price for you to sell it, because we're not going to give it to you if you're going to turn around and price gouge everybody and price people out of the market, and then people are going to suffer and maybe die. That's crazy. But the U.S. doesn't do that. The U.S., we just developed this government research that you paid for. We just developed this. Now we're going to turn it over to a company you can sell for however much profit you want, and you can price gouge the shit out of people. Think about how crazy that is. That's nuts. That's nuts. And then also this busts up the myth. They're like, well, you have to understand that innovation only comes out of the private market because there's competition, and then they do the research and development, and so you only get the really good innovation. It only comes out of the private market. Whoa. These are cures and treatments created by taxpayer money, created by the government, created by universities, taxpayer funded. And then they turn it over to the pharmaceutical companies. The pharmaceutical companies sell it, and then they take all the credit. See, we're geniuses. We created this, put a lot of money into this, and now, look, understand that we're selling it to everybody, and we needed to do the research and development. But you didn't do the research and development. What are you talking about? So Bernie's saying, look, okay, if we're going to turn it over to a pharmaceutical company, you at least have to charge a reasonable price, and we're going to negotiate for what that price is on a case-by-case basis. There's never been more clear legislation that is rational, logical, and ethical and moral. And if you disagree, that's just crazy. So this is a company, by the way, where they have a multiple sclerosis drug, and it costs 8 times more in the U.S. than it does in France and the United Kingdom. This is primarily a French pharmaceutical company. It costs 8 times more in the U.S. than in France and the U.K. So for Bernie to say, hey man, you guys have a history of price gouging. They also price gouge over insulin. There was another story about that. They were sued over how they price gouge people for insulin in the United States because they can get away with it because the laws are lax. So Bernie says, let's fix those laws. Let's make it so they can't fucking price gouge Americans. Guess what? This amendment is considered dead on arrival. Excuse you? Yeah, they go, no, it's not going to pass. It doesn't have the support. It doesn't have the support. Why? Virtually every Republican's against it. But it's not just the Republicans. There are about 13 Democrats who are deep in the pockets of Big Pharma. So they do Big Pharma's bidding, and Big Pharma says, nope, not this one. Sorry, you're going to vote against it. And then they'll vote against it. So a piece of legislation that if you poll the American people, it'd be over 90% of the American people that say, of course, what are we, crazy? Yeah, you allow the government to negotiate for better prices for the drugs, especially since we developed it with taxpayer money. We fucking paid for it. There's an argument we should get it for fucking free. But no, taxpayers developed it, you developed it because of your money and the research we did as a society, and then pharmaceutical companies take it and price gouge you. And there's no chance of getting legislation through that allows the government to negotiate for a reasonable price. This is the fucking problem in our politics, and this is why Congress has like a 9% approval rating, because of shit like this. We know we're getting screwed. We know big donors run the country. We know big pharma, for-profit health insurance companies, Wall Street, big banks, the military-industrial complex. We know they run everything. And you can't tell us otherwise. JusticeDemocrats.com/fight. You have to support Justice Democrats. Donate to our candidates because we don't take any corporate money. We don't take any PAC money. We have principled people. Read our platform, justicedemocrats.com/platform. That's what our candidates stand for. And we need you because our opponents just go get big checks from big pharma and for-profit health insurance companies and Wall Street, and then they have way more money than we do, and then we're in trouble. So we're at an institutional disadvantage. We need you to make that up. JusticeDemocrats.com/fight. Because legislation like this should breeze through. But it doesn't breeze through because our government is bought. Let's fix that.